Okay, so those are all these kind of different things to look at and different things for you to see at home and pick up on and identify that may tell you something's wrong with your bunny. But what do you do then if you see one of those problems? Well, you have to go to the vet as soon as possible. Now, it's always best, because that's the other thing, is a lot of times people say, can I wait? Do I have some time to wait? And I always tell people it's much preferred to see your animal sooner rather than later. Yes, there are certain things that we can wait a little bit, but I don't like to wait too long because, as we were saying originally, rabbits are really good at hiding signs of illness. And when they start to show that they're ill, it could potentially be more serious than maybe what you're picking up on at home. So, if you can get to the vet as soon as possible, great, go there. But if you can't, because it's a Sunday night, or, 2 in the morning, that kind of thing, a couple of quick things that you can do at home to kind of assess your rabbit and get an idea whether or not you can wait till the hospital opens in the morning or you need to get to that emergency clinic right now, is take a temperature. And we'll show you guys how to take temperatures. Next, check for bloat. And so checking for bloat is, again, feeling that stomach. And again, I'll demonstrate how to feel a stomach. If there's any wounds on them, go ahead and clean any sort of wounds that could be there. And if they're not eating and they don't have a bloat, you can assist feed them. So again, that bloat is the stomach's really big. So if you feel a stomach and it feels like a balloon, don't feed that bunny. That bunny has to go into the hospital. But if you kind of feel in that stomach region and things feel empty or soft and okay and they're not eating, it's always okay after that point, as long as it's not a bloat, to go ahead and assist feed them and get some food into them. So, as far as things that you can use at home is getting a washcloth, nice warm water, warm to your touch. You don't want anything that's like boiling hot. And just regular like dish soap, just plain regular dish soap is fine to use to clean a wound. I recommend, rather than putting the rabbit, underneath the sink and cleaning it, unless you're used to doing that and you're experienced with doing that and you know how to handle them so that they're not stressed, it's best to use a washcloth because then you can be very local to the area where there is a potential wound. You can put things like Neosporin on a wound, but it has to be plain, boring, regular Neosporin. You don't want any of those triple antibiotic ointments that have something else added in. You don't want any of those like pain relievers or anti-inflammatory, anti-itch, any of that stuff. Plain, regular, triple antibiotic, Neosporin, that kind of stuff is safe on a wound for a rabbit. Vetricin is fine too. If you have something like that was prescribed by a vet, then that's fine. And Vetricin is a very safe thing to use. Tiny little skin wounds usually take anywhere from, if they're very small, that can take a couple of weeks to heal. Yeah. It's something that the skin generally somewhere around generally 2 weeks. All right, so for our temperature. So how we actually take our temperature is we'll put our bunny kind of onto its back, supporting it, of course, so that our one hand is underneath the rump, the other hand's kind of over the chest, and those little feet are kind of out. You want to use kind of either a soft, flexible tip thermometer. If it is one of the firmer tipped ones, as long as it's not your mercury thermometers. You never want to use those old mercury thermometers and those glass ones. It has to be plastic. You insert it into the rectum, and you do actually insert it a little bit of a ways, anywhere from 2 to 3 centimeters, kind of gently into that rectum. You never want to shove it in there. Kind of gently pass it into there. Again, the normal temperature range, 100 to 104. And then based upon whatever temperature you end up getting, if you have a temperature that's in that normal range, okay, fine, your rabbit's okay. But if we're too cold, a heating pad is always important to put them on. If that temperature is below 100, if you have a heating pad at home or you have some sort of like rice sock thing that you can heat up in the microwave to have them sit next to kind of get that temperature up would be great. And those little rice sock things are great because you can package them into their carriers and take them to the vet so that while you're driving, they're at least getting somewhat warm. I tend to put them to like medium. I never put them above that because I never want to burn them. And that being said, always checking it yourself and putting your hands in there quite frequently. Here in the hospital, we set timers. So if there's an animal that's under temperature, we check its temperature every 15 minutes, and there's a timer that's going off so that nobody is, you know, getting late on it, so that we know we are checking that temperature at that specific time, so that animal is not getting overheated, and we're being really on top of it and making sure we're getting them to the right temperature.
Checking the animal's temperature?
Checking the animal. Now, for you checking at home, I don't necessarily want you to be every 15 minutes throughout the middle of the night temping them, because that can be a little bit traumatizing. If their temperature is low, you know, it truly is lower than 100, and you get them on a heat pad and you can't get to the vet, then maybe checking it like every half hour initially until you can get to a stable point. But feeling that heating pad, actually putting your hand between the rabbit and the heating pad itself so that you can get a sense for it. Does this feel okay? Does this feel like an appropriate temperature? Oh no, geez, my hand's really hot. I need to take the temperature down, or I need to put you know, an extra towel or something between the pad and the rabbit. And you never want to have just your plain plastic pad right up directly against your rabbit. You do want there to be some sort of, you know, cloth barrier, because you don't want them to get too hot. If they are too hot, if you do have a temperature above 104, you can do fans, you can do little ice packs, but you have to be careful because you can drop their temperature rather rapidly. So it's something that you put one ice pack, or, you know, you turn on the air conditioning when you're driving to the vet. So here's a picture of taking a temperature. So we have our rabbit on his back. There's a hand supported underneath the rump area. There's another hand up here, kind of right over the chest. The other person is holding that kind of tail to expose our little area. Now, the rabbit little underparts there, you have your urethra opening and then your rectal opening. They're right next to each other. So there's going to be two holes. Go for the lower hole. Don't go for the upper hole. That would be uncomfortable for the body. The hole closer to the tail, that's your rectum. That's where you want to go into. Because though they don't necessarily like having their temperature taken, they're going to be a lot calmer that way than if you put it in the wrong spot. It's always helpful to have a second person too, if you have a second person available. And I can show you how we hold them upside down when we do like individual demonstrations. And certainly some rabbits, when they're at their house and they're in their territory, they don't want to have any of this kind of stuff happen to them. And then they come to the hospital and we're like, oh look, it looks so easy. And you're like, and it's because they're just, you know, they don't know who that weird alien person is that's holding them, and they're just like, I'm just going to sit here and not do anything because I'm really scared right now. So sometimes I apologize, we do make things look a lot easier than they are in real life sometimes. I never like them to be on a table though, because then they can kick.
Yeah.
And if they kick, they have so much strength and power in those hind limbs that they can hurt themselves, and I have seen a rabbit fracture its back before from kicking. Not because it was getting its temperature taken, but just because it was simply so upset because of other stuff going on that it kicked and hurt its back. So, and there we go. I'm just kind of demonstrating, if you look, between how long that is and how much I actually inserted it. So, because if you insert just that little tip, you're going to get a lower temperature reading. You kind of want it to be... So we already kind of talked about this part, the feeling the stomach, feeling for bloat. Is it big? Is it firm? Does it feel like there's a balloon there? When you have a bloat, the temperature is often low. Like, I would say, there was a rabbit actually that came in, I think last month, sometime in the last month, that wasn't a bloat situation, and it didn't have a low temperature, and we were like, what? It doesn't have a low temperature? You know, we were shocked. So 99% of the time their temperature is going to be low and you feel this big stomach, and that's a bloat. They're often really painful, they're quiet, they're lethargic, they're not wanting to do anything. And those are emergency situations. Those are rabbits that have to go to the vet as soon as possible. You can't wait on these guys because, you know, an hour can mean the difference between life and death. You know, so it's not something that, oh, it's, you know, 4 o'clock in the morning, we'll wait till they open at 8 o'clock, 9 o'clock, whatever time it is your vet opens up. They have to go to emergency. Yeah. Emergency clinic, there is a newer doctor, there's a hospital called Access. It's in Culver City, and we actually have her card, so I can give you some of her cards too. But she does 24-hour care. She's not necessarily in the hospital, but they call her into the hospital. So in these bloat situations, yeah, you want to get to the vet right away, but if their temperature's low, do try to warm them up while you're in transit to the vet, and do not feed these rabbits because they don't need anything else additional in that stomach. It's just going to make that stomach larger. Oh, and then here's just a description for your cleaning your wounds, that warm soapy water. I did put, because some, like if you've been to the vet before and they did prescribe some sort of cleansing agent, the typical cleansing agent that is prescribed by a vet is something called chlorhexidine solution. What you can get is dilute betadine. Like if you go to a pharmacy, you can purchase betadine and you dilute it out and you can use that. That's a safe cleaner as well. And then again, your ointments, your video I used one. So if you have betadine, you want to make it to like what looks like a weak tea almost. It's fine. I remember my dermatologist in school, I said something once about cleaning something with hydrogen peroxide, and she was clearly very upset with me. If you ask a dermatologist, they would say no. So okay. I'm going to say no. Alright, so assist feeding rabbits, something that's very important to know how to do. If you haven't had to do it with one of your rabbits before, then you're lucky. Because it's probably one of the most common things that we're having people do with their pets. Assist feeding them, the reason we're doing it is, again, because since rabbits are always eating, always pooping, if they're not, we need to keep that gastrointestinal tract moving, and simply getting food into that gastrointestinal tract can stimulate normal motility, can stimulate things moving through nicely. So there are several different products that are available for assist feeding. Critical Care is the first one that was a commercial product, but there are other things out there. Herbivore Care is one, and there's some other companies too. And basically what they are is they're basically hay that's ground up really fine. There's some extra vitamins and minerals added, so it's kind of a little bit more balanced. And then you reconstitute it with water, make it the consistency of a baby food, and then you syringe feed it into their mouth. Herbivore Care is Timothy hay. There is another company called Supreme, and I think theirs is Timothy hay as well, but they may have a little bit of alfalfa mixed in with theirs. I'd have to actually look at their ingredients on their product. You can do baby foods. You can even sometimes mix baby foods in with your Critical Care, Herbivore Care, that kind of thing, because it can sometimes be a little bit more tasty for them then. Of course, since a rabbit and they're herbivores, we need to look at things like mixed, baby foods that are veggies. We don't want to put any sort of chicken or turkey baby food in with our Critical Care for our buddies. I mean, maybe they'd like it, I don't know, but I'd recommend against that. And in your guys' packets that you have, Kat actually did make I think there's an actual little ingredient recipe. There you go. Thank you. I don't cook. There's a recipe on how to do, make your own sort of stuff at home if you don't have Critical Care or something. But, your orchard, your oat hay, those are fine. If I have to give you Critical Care versus honey water, you would never choose honey water over Critical Care because you're not going to get all the nutrition that you actually need from your Critical Care. And honey, I mean, it's not the kind of calories that we want them to have. So yes, you can use that for mixing with medications, or maybe mixing a little bit in to kind of get a taste and a flavor to allow them to accept things, but you wouldn't use that as a replacement for Critical Care. Like anything in the world of diet, there's controversy that exists, and you're going to get different opinions. But pineapple, the purpose behind pineapple is people were using that to help with any sort of potential, fur blockages that could be going on, because it could kind of help to break stuff up a little bit. But if you just have a gastrointestinal stasis that's not due to some sort of blockage, it's not really going to do much of anything for you. It doesn't hurt to have it in there, but it's not going to necessarily, it's not going to be necessary. So that's why I'm not a huge fan of those particular things, is because if you give too much, everything in life is balance. And so too much of anything can be a problem, right? And no matter what it is. So if you give too much, it can alter your gastrointestinal tract pH. If you alter the gastrointestinal tract pH, all those nice happy little bugs that are living in there that are helping to digest all the food that these guys can digest that we can't digest, they're unhappy. And if they're unhappy, they die off. You can have bad bacteria overgrow, because then the bad bacteria are in a nicer environment that is good for them to grow, and then you can have another problem on your hands. Because when people are using those things, it's to try and help with, you know, fur balls, those kind of things. But what I think works better than that, one is brushing the rabbit so that you're getting all that extra fur that's kind of sitting in there out, and they're not ingesting it so much and having problems from it. And two, giving them a laxative when they are going through a shed. And so like your Petramalt kind of stuff. So the Petramalt stuff, that's more kind of a laxative kind of thing to help things move sort of through, and that you can do like anywhere from 1 milliliter to 2 milliliters a day. That seems to be a bit more effective at actually preventing. I wouldn't recommend Vaseline. I would recommend Laxatone if you're doing it as a preventive. If they had a little bit of it for a moment, that's okay. It's not the end of the world, but I wouldn't recommend it. I wouldn't recommend it repetitively. So Laxatone is going to be your laxative. It helps to hydrate that gut and get things passing through. Simethicone is to reduce gas. And so what it actually does is it kind of breaks up the gas that's in that gastrointestinal tract. If you have a rabbit that's gassy, you're going to be using simethicone. If you have a rabbit that is blocked up by a little bit of hair, you're going to be using Laxatone. The problem is you don't know. And so, or you can have both of those things going on at the same time. So sometimes you need both of them. So that's why it's important to have them checked out when they're going through those kind of situations, because then you have a little bit better idea of whether or not you need to be using, which ones you need to be using. Do you need to be using either? Do you need to be using both? Do you need to not even worry about that stuff because you got a completely different issue on your hands that you need to be addressing? The Laxatone is usually just like a once a day kind of thing. When they're going through a shed, you can do it every day, so it doesn't hurt for them to have it every day. But then when they're not shedding, they don't necessarily need it. So they typically go through a shedding once every 3 months, but usually what you do is twice a year it'll be a big shed, and the other 2 times out of the year it's sort of a small shed. So then just some pictures on how to assist feed these bunnies. And the thing with getting stuff through a syringe, it's good to have a feeding syringe. Like your medication is typically very narrow, and so you can see you're not going to get much through there. So it's nicer to have those bigger, wide nozzle ones so that you can actually get stuff through. Because, I mean, these products, since they are basically like a hay or pellet thing that's ground up really fine, it's still thick. Okay, so assist feeding, if you guys haven't had to do it before, there's little incisors right in front. You never want to bring up a syringe right into the front and hit those incisors because that feels a little funny to them. So if you remember back to that picture where I was kind of showing the incisors and then the molars far in the back, and you notice that there's this kind of wide space between your incisors and between your molars, that's where we're actually introducing our syringe. Right behind those incisors, into that space, it's much easier and then more accepting of it. So you can see this little guy, we're holding the syringe up kind of to the side and right behind those incisors to actually squirt that food into there. And really, I mean, assist feeding, the way you're doing it is the same way that you're going to be doing your medications as well, medication administration or oral medication administration. Okay, so for some at-home care, of course it's important, you know, once you've gone to your vet, you've got your diagnosis, you know what you need to do to treat your pet. Of course you need to follow all the instructions accordingly because that's very important to do. And then as far as some tips for medication, for jumpy bunnies, consider the bunny burrito as an effective restraint technique. Because some bunnies just do not want to take their medications, they don't want to take their critical care, they are just very upset with the whole process. So a bunny burrito is a safe and effective restraint mechanism for a rabbit. So what you do is you're going to have a towel, you set it down on a tabletop, place the rabbit on the center of the towel. You're going to wrap that towel over the butt, because then they can't back up and back out of it, and then over the sides. So a little demonstration here. This person who was doing the bunny burrito decided to wrap a side first, then a back, and then the other side. And you can see your bunny is nicely restrained in its bunny burrito. Some bunnies like to push their little legs out. You can always take that little piece and wrap it right over those front limbs too. So it's just a little head. So again, those oral medications, you're going on the side of the mouth, not straight in. Give them slowly, small increments, unless the rabbit really likes it. Some rabbits are like, ooh, I love my medications, give me more. And one of my own personal rabbits, she grabs onto the syringe and she like tries to gnaw the end of the syringe off because she just wants more of it, which is funny, but it's good that I have an easy to medicate rabbit. Okay, so subcutaneous fluids. or subcutaneous injections. So if you remember back to that picture of the cat, the only cat picture that was in this lecture here, how the guy was kind of pinching that skin up between the shoulder blades, that's kind of the exact same spot you're going to be going. You're reaching between those shoulder blades and pinching that fur, that little extra fur up in that region. You then make it essentially like a little tent. And what you'll do is at the base of the tent, so right at the bottom, that's where you're inserting your needle. You draw the needle back first because you're checking to make sure that there isn't any blood coming into the syringe, because if there is, that means you just hit a blood vessel. Highly unlikely, and if any of you guys hit a blood vessel going in right there, then you are awesome, and we need you to come and draw the blood from all the rabbits in the hospital. But there's a very small chance that you're ever going to hit. If you do get a little bit of blood, it's going to be a teeny tiny little vessel that's right there. But you're just checking to make sure that you're not getting any blood, you're not getting any air. If you get blood, if you get air, don't freak out. You just back your whole needle out and redirect, go to another spot. If you just get negative pressure, if you pull back and it's, you know, just kind of sucks in and then wants to go back in, you're in the right spot. You just then squirt in and you're good. So here's just a picture. We're tenting the skin. You can see we make a nice little tent, and then she's injecting kind of at the base of that little tent of skin.